Expanding who can get the AstraZeneca vaccine here is causing the provinces to rethink their vaccine rollout. Michael Couture has our top story tonight.
I think that people have to realize that it's not that we're flip-flopping, it's just that we try to monitor the evidence.
The head of the National Advisory Committee on Immunization might have sounded a little defensive while trying to explain how the guidance changed in a matter of weeks. NACI never said the Oxford-AstraZeneca vaccine was bad for Canadians aged 65 and older. There just wasn't enough data to prove it was good. And Dr. Caroline Quash-Tan used a colorful analogy to describe the enormous task of approving a vaccine.
Ideally, we would do one recommendation with all the data in hand, but that's impossible. So that's why, you start with one thing and you start chewing that elephant slice by slice.
Okay, this is a real one right here.
That explanation was tough to digest for Ontario Premier Doug Ford. He's promising people already booked for the shot through the province's pharmacies and primary care settings that they won't lose their spot. But he says the new guidelines throw a wrench into the province's immunization plans.
They're changing and moving the goalpost. I can't begin to tell you the logistics behind it. It just messes everything up, to be very frank with you.
Ontario and Nova Scotia are now both reviewing the new NACI recommendations.
I'm a little upset with NACI as well.
This epidemiologist says the committee should have seen the real-world data on the vaccine sooner. Quebec did that and already started using the vaccine in that age group. But there is concern the mixed messages around the shot erodes faith in the process.
Unfortunately, we can't wait 2 years until all the answers are in before saying this is our best estimate of how these vaccines work and where it should work. You got to do it now to save civilization.
And that's only possible with proper communication and some education, which lead to buy-in from the population. Michael Couture, Global News, Ottawa.
There is lots to take in about this. To add more clarity, Dr. Suman Chakrabarty, an infectious diseases physician, joins me. Doctor, people sometimes get blood clots. I had deep veins thrombosis, for example. It had nothing to do with any vaccine. Based on the evidence so far, should Canadians be worried about the AstraZeneca vaccine?
No, based on what we know so far in our trials and also what's seen in real-world experience in the UK, there's no signal that there's any increased risk of clots. And it's important to watch for this, in the post-marketing analysis. But right now, there's no evidence for this. So I think that we have this vaccine that's quite safe and effective, and I urge Canadians to get it.
We are still in the midst of a pandemic. Half the new cases in Ontario, for example, are now the more transmissible variants of concern. Can we afford to hesitate about getting vaccinated?
It's a good point. And, people have a lot of questions. I think it's important to answer them and alleviate fears. But yes, vaccination is our ticket out of the pandemic. And it's important to try to get as much widespread vaccination as possible. I want people to be able to make an informed decision. And that's what our job is right now, to help with that. But overall, we have now 4 choices that are very, very good and safe. And I would urge Canadians to get whichever one is offered to you, and we can get out of this outbreak as soon as possible.
The risk analysis, risk-benefit analysis, what are the risks of not getting vaccinated right now, especially for people over the age of 65?
Yeah, we do know that as the older you are, the higher risk you are of getting severe disease of COVID, hospitalization, and of course, death. And, the thing about COVID, it's something that can, affect you in a way that you might not even expect. So I think it's important that with vaccination, we prevent all that. We prevent death, we prevent morbidity. And that's, I think, the biggest thing we want for all of our population, protect everyone, and really kind of get the key to exiting the pandemic and making this all a memory behind us.
That would be nice. Dr. Chakrabarty, thank you so much.
Thanks for having me. Take care.